broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. This is Karen de Blasio. I'm a desk officer in the SNAPS office at HUD headquarters in D.C. I want to welcome everybody to this HMIS summer training series, the first webinar in this series. Today's webinar is on data standards, consent, and information sharing. We're very excited to have folks on this webinar. We've got hundreds of people registered, which is just very exciting to us. We had a huge response to the webinars that we did in March when we released the program manuals. So we are happy to see so many of you all on the webinar today, and we're hopeful that you all can tune in for the rest of them throughout the summer as well. I do want to apologize for the registration challenges that we had. As you all can tell, we are implementing a new process in how we conduct our webinars, and we're doing them through a new system. We are still using GoToMeeting, obviously, but we are doing the webinars through a different system, and they'll be posted on the HUD Exchange after we do the presentations. But I know that there was a lot of back and forth between a lot of folks because I don't think the instructions were as clear as they could have been around the registration process, and people were receiving emails that led them to believe, I think rightfully so, that they were registered, but they had to follow an additional step. And so our contractors worked really hard to try to get everybody registered. Hopefully we were able to get everybody to complete the final step, but I just want to apologize for those challenges, and hopefully we've worked through that and we won't have that happen again. And that's why we decided to start about 5 minutes late, because we know that there were still some people who weren't sure how they could log on. So I appreciate everybody's flexibility. I don't like to impose on people's time like that, but we kind of felt it was necessary in this instance to start a couple minutes late. So on the phone with me today, I've got a couple of folks that you'll be hearing from. I've got, as I said, I'm Karen de Blasio. I'm here in Washington, D.C. in the HUD headquarters. I have some national HMIS TA providers who you'll be hearing from throughout the afternoon. Michelle Budzik is with the Partnership Center in Cincinnati, Ohio. She's one of our TA providers. And then I have Dan Fox and Joel Remigio both from the Cloudburst group. And they helped put the slides together, and they will be answering, doing some of the questions and answers during the presentation, and you'll be hearing from some of them as well. So I think at this point, the only other thing that I want to talk about before I kind of hand it over a little bit is again really just to reiterate the purpose of today's webinar and the following webinars that we have in August and September. As the slide said, this training is one of a 3-part series. It's really geared, as the earlier spring trainings were, it's geared towards HMIS lead staff and system administrator staff. Like I said, we got such a huge response. We had so many people that really were appreciative of the trainings in the spring. It just made perfect sense to kind of continue on with that and really gear some more trainings towards you all. Our intent here at HUD is to have, obviously, today's training. The training in August will be the second in this series, and that will focus more on reporting from HMIS, and we'll touch on, how the critical changes that we'll talk about today may impact reporting. And then the third, which will be at the end of September, will be on system performance measures and kind of what you as a system administrator or an HMIS person needs to know about COC-wide system performance. Once we get through those general webinar sessions, if you will, our intent is to then move towards having a monthly call with this kind of group. This is a large group, but I think it's really, really important. We want to start having regular communications with you all. And so we want to have a monthly call with system admin staff, with HMIS lead staff, so that we can use that call as a training opportunity, but we can also have a little bit more interaction. As Joel will go over in a minute, right now we're really, because we've got so many folks on the phone, and because we have so much material to go through in this hour, we want to make sure that we were able to cover everything, and so we're not going to open up the phone lines for questions. But when we have a more kind of informal, less HUD talking and presenting type call with you all, starting hopefully later in the fall, we really will want to hear from you all. We want to, encourage you to ask questions, that sort of thing. So that's the direction that we're heading in. Hopefully you all will find that useful, and there'll be some more information coming out about calls following September. I'll probably get that out in the next month or so. So just keep an eye out for that, and we'll let you know what you need to do to kind of register and make sure that you're aware of the first kind of group-wide call when that happens, which will probably, hopefully, be in October. So I want to go ahead and hand it over now to Joel so he can talk to you a little bit about submitting questions during the webinar.
Thanks, Karen. As Karen noted, we have a lot of people on the call, so there's no way we're going to be able to unmute the phones. That might be just a little too chaotic. However, we really do want to answer all of your questions. So if you're you'll see in the GoToWebinar software, there is a panel for questions. Okay, there's two panels, one for questions and one for chat. We'd like you to use the one for questions, to submit your questions there. And we will answer as many of them as we can. We've allotted more time this time than we did in the spring because, again, the feedback we got, like Karen said, was overwhelmingly positive. Just being able to give everybody this opportunity to ask questions and to have them answered is clearly really valuable to everyone out there. But we may not be able to get to everything. Some questions also tend to get a little complicated and may apply to very unique situations, and we might need to think about them a little bit longer. In which case, we may redirect you to using the Ask a Question portal on the HUD Exchange, through which we can then take some more time to give you an answer that's going to be appropriate for your situation. So again, ask as many questions as you want to in the questions panel, but also feel free after the webinar's over to use the Ask a Question portal. And I'll turn it over to Michelle.
Thanks, Joel. So we're going to talk about the critical changes that are being made to the data standards beginning October 1st, 2015. So let's just, we're going to walk you through these. We're going to identify for you whether they're new elements, brand new elements, or whether they're revisions to old elements. And we're going to tell you about data collection for each one of these elements and what you have to do for that. So you all know the vendors have been told that in an HMIS beginning October 1, 2015, all of these new elements must be there. We also, though, heard from you from the last time that you didn't feel like you had adequate amount of training time to show your users how to use the new elements. Now, though there are not that many this time, and the training should be much, much easier than you had last time, we have told the vendors that it is their responsibility to work with each one of their customers to help you with whatever information you need to be able to go forward. So that could be that they've given you screenshots. It could be that they've given you a sandbox. Maybe they've given you some documents. Each vendor would handle that differently, but your vendor should have something for you to help you show the new elements to your staff. And I would expect those to be in your hands mid-August, beginning of September at the latest. They are probably not there yet now. The critical changes, what we did was sit down with all the federal partners and ask that only changes that were kind of mission critical were made this round. So only changes where somebody's really messed something up, or we've got to get something better because of some kind of political will or OMB, that we've made changes. So all of the changes are right here on your screen in front of you. That's it. That's all of the changes we're making. So let's start with 3.12. There's no change to the element. It's the destination. Where do you go? Where are you going when you leave? The only change that we're making is bringing the universe of who answers the question back to the original universe of this question. That is all clients have the question and presented and answered. We tried to, in the last round, slim this down to adults and head of households, and the response was pretty unanimous through the question and answer pool that people were having problems when perhaps a child left earlier than the rest of the family members, and they didn't have a way to show where that child went, or they didn't like that the head of household went to jail and then they had to show the children as going to jail. It just wasn't appropriate for them, and it's not appropriate. So we changed it back to having all clients answer that question. We understand that from the vendors that most of you still have that functionality in there, and probably users were still using that. So hopefully this isn't a big change for you.
Hey, Michelle.
Hey, Michelle.
Yes. For a second? We seem to have a technical problem. We just got flooded with a bunch of questions that people can't see the slides. So it seems kind of widespread. I don't know what the problem is, but yeah, we just had like 20 people, like I am in, saying they can't see the slides.
Michelle, I think the problem is you need to end presenter mode and, yeah, swap presenter view and slideshow. Go ahead and hit that.
Can you see them now?
It did change, so I'm going to...
Some people, I think, aren't set up to be able to see the widescreen, which is what was showing up, but I think now, all right, yes, people are confirming that they can see it. Sorry about that.
That's okay. Let me just go back and show you then, for the people that couldn't see the slides, that these are all of the elements that are changing. There are not that many. This is the total list of elements changing. The HMIS data dictionary and data manual should be on the HUD Exchange sometime this week, and at that point you'll have this all in writing for you, and these slides will be posted so that you can pick them up also. We just went through destination, and we talked about the universe of clients changing to all clients. And now we're going to the fun-filled 3.17 that we need to first tell you that we understand your kind of pain in trying to get people to answer the question. So 3.17 is divided up into two parts. The first part of the new question is asking, are clients entering from the street, shelter, or safe haven? If the client is not entering from the street, shelter, or safe haven, they will not be counted then as chronically homeless for this episode. So if they're coming directly from the street, shelter, or safe haven, then you say yes. Then you're going to ask, approximately what date did you start staying on the street, shelter, or safe haven? Combined, not separately, combined. Essentially, you're asking, how long have you been homeless? What's the date you started to become homeless? With homelessness being street, shelter, or safe haven. If they know the date, you put in the date. Great, you move along. If they don't know the date, then you're going to work with them to help them figure out the date. Like they say, I've been homeless since last month. Well, if today is the 7th of the month, and they said they've been homeless since last month, you can go ahead and put in the 7th of July for the answer. You can put in the last month. If you have HMIS data that can help you figure out when somebody was last homeless, you can prompt your client with that information, like, well, gosh, the HMIS says that you've been in a shelter since January 1st. Is that right? And if he says that's right, you can put in January 1st. You can't just turn around and not ask the question and rely on your HMIS data. We know that HMIS data has lots of gaps in it because people move around and are on the streets and not picked up by an outreach worker, or may move into a shelter that's not on HMIS. So you may not just use HMIS data to answer the question, but you may use HMIS data to help your client answer the question.
Michelle, I'm still receiving a bunch of people that can't see your screen, so give me just a moment here. All right, try sharing your PowerPoint again. And some people are reporting that logging out and back in fixed it. Okay, people are starting to say that they're able to see it now. Awesome. Sorry about that. All right, Michelle, go ahead.
Okay, so we're back on 3.17. We're taking a look at, we're putting in the approximate start date. So the first part of 3.17 is the client entering from the street, shelter, or safe haven, yes or no? The second part is, if yes, what's the approximate date that they started living on the street, shelter, or safe haven? The next part of the question then is, no matter where the client came in from, whether they came in from transitional housing or permanent housing or their grandmother's house, you're going to ask the question, how many times have you been homeless in the past 3 years? No matter where they've come from, you're going to ask, how many times have they been homeless in the last 3 years? And living on the streets, shelters, or safe havens. They're going to answer the question, and then you're going to ask, what's the total number of months that you've been homeless on the street, shelter, or safe haven in the past 3 years? Now we know that what we're doing with this question is causing you major angst in that you're trying to explain to your end users what the correct answers might be for chronic homelessness, and then the end users are trying to guide the homeless client into answering the questions correctly. We're asking you to try a new approach. Just ask the question. Don't try to guide the answer. Don't try to guide the end user. Just ask the question. In our attempts to try to fix this, as we've run this through a variety of methodologies, what we found is just asking the question in general nets you the right answer. And so instead of trying to over-train on this element, we're going to try to go for just ask the question. Last time when this element was implemented, y'all had trouble because everybody that was in residence on October 1st you had to go back and ask the question of again, and it was hard on the homeless folks and it was hard on your users. This time we have mapped the data from your old responses to the new question. It's not a perfect mapping, and there may certainly be corrections that your users will want to make to the data the way they see it mapped. But we have provided, or will be providing this week again to the vendors specific mapping that we want them to make. So if in the past the client has indicated that they were homeless for at least a year or that they were homeless for a specific number of times, we're mapping that into yes, they were homeless and entering from the streets. We assume, again, since the question was only supposed to be answered if they were coming in from the streets, that in fact the streets are, in fact the answer would be yes, and so we're going to put that in as yes. And then in the past we asked the number of times the client's been homeless. We're putting that in there now. We're bringing that back over, and the number of months the client was homeless, and we're bringing that back over and going to map that all. So you should only have to begin answering the question or asking the question of folks that are coming in brand new into your into a project beginning on October 1st. You should not have to go back and re-ask the question unless for some reason the client was never asked it over the past year. So that should, we hope, alleviate some of the difficulties that we had with this last time. 4.11.
Michelle, I'm sorry,
yes.
Can I jump in and say one thing before we leave this element, just to give a little bit more context of, like, you've already kind of touched on this, but so just to build on what Michelle is saying, because we know that this is probably one of the most angst-causing elements out there, and you know, Michelle has already told you guys, you know, really our intent is, and we had many, many hours of discussions around how this question, or you know, how this data element is implemented and how it's used, and we really just came down to, we just need folks to ask the question. I don't want folks to think, we know that depending on who's asking this information, who's working with the client, at what point in the process you're gathering this information, we know that in some cases, you know, case managers may sit down and almost try to do somewhat of a housing history or something with their clients. That does not mean that we want you to stop doing that. I don't want people to take away that, you know, we just ask the question and stop. You know, I mean, we've said that, and that's what we mean for this particular element. But it's really more, as Michelle was saying, our point in saying that is so that we don't want case managers hung up on using this one element to try to determine if somebody's chronic and trying to kind of overwork or overreach with this one particular element. Just, you know, simply ask them, you know, where are you coming from? How long were you there? You know, we know that some people get into housing histories, and that's okay to do at some point, but we really just need you to get the information that the client's giving you, or your users need to just get the information the client's giving them and move on, not try to kind of overanalyze it and right there on the spot determine, you know, is this an episode, is this not, is this a, you know, are they chronic, are they not? So I just want to make sure that we're clear about that. Sorry.
That's great, Karen. Let me, I was able to look at some of the questions real quickly while you were talking, and let me just go back and say this element begins October 1st, 2015, and so beginning with the people who entered the project on October 1st, 2015, this question needs to be asked and answered. If your clients have been in housing for 5 years or 10 years, you should have asked the 3.17 question last year. On October 1st of 2014, the original question should have been asked to clients, and we gave you a year of annual assessments and time to ask those questions and get it in. So Hopefully all of those people that have been in housing for a long time were asked this question last year, and now the answers that they were asked last year are being mapped to the new question, and you will not have to ask the new question again. If you did not ask the question of your older clients, you need to come in and do that now. Everybody on October 1st should have some kind of response to 3.17 in your system. It's either an old response that's been mapped in, or it's a brand new response that just happened on October 1st. And we will answer the couch surfing question in writing for you, because I want to check the answer that I'm going to give you before we actually give it. We understand that there's a difference between sleeping on somebody's couch and residing there semi kind of permanently to flopping on somebody's couch one night, and next night you're on the street, and the next night you're on somebody else's couch, and the next night you're at somewhere else. So we understand that there are deviations on that theme, and we'll get you an answer specifically to that one in writing in the future. Let's go real quick to 4.11, domestic violence. This question really didn't change much. It's still, have you experienced domestic violence? And the answer is yes or no. Client doesn't know, client refused. If you read the data manual last time, you would have seen that the question changed a little bit to ask, are you fleeing from domestic violence, rather than are you a domestic violence victim or survivor. People across the country didn't make the change, and so we put in a second part to the question. So the question now says, are you a domestic violence victim or survivor? Yes, no, client has no, client refused. And then if yes, when did the experience last occur, and are you currently fleeing? The only people that you would want to adjust their responses for this question would be the people in residence beginning October 1st, 2015. And if you miss folks this first year in getting that updated, there's not a crisis to that. There's no, this is not going to be reported like this on the APR this year, and so you'll be fine. But we're going to ask you that if they said yes before, on October 1st, you want to update that to ask about the fleeing information. There's an element change to 4.14E, services provided as a bed night date. It should not mean that you, let me say this better, you should not have to do anything to account for this element change. All this element change does is show the vendors and the exports where exactly they put the bed nights if your client is sleeping in an emergency shelter that's a night-by-night shelter and has to account for bed nights. So if your system currently accounts for bed nights for your mass shelters or your night-by-night shelters, those places where folks come and go quickly, maybe don't always do an exit, do not have a fixed bed every night, generally the mass shelters of the country, you're doing something to collect that Joe Smith stayed on January 1st, and then he came in again and stayed on January 5th, and then he stayed on the 6th and 7th and 8th, but then he wasn't back in until February 1st. Though, whatever you're doing to put those dates in, whether they're using a scan card, whether you're typing in the dates, or you're checking off a box for the dates in your software system, whatever your system allows you to do to account for those dead night dates, those dates are going to go into the 4.14E for export purposes. You should not have to do any new training on this element at all for your system as long as your system currently captures dead nights. The RIDE program, Runaway and Homeless Youth program, has fixed 2 elements. These elements only pertain to the RIDE projects in your system, and then they pertain to all of the RIDE projects in your system, from street outreach, BCP, TLP, and MGH are now being asked a question about commercial sexual exploitation and one about labor sexual exploitation or labor exploitation. So 4.35A is asking, have they ever received anything in exchange for sex? If yes, then how many times in the last 3 months? And did somebody make them have sex in exchange for something? So the first one is asking, have you ever? The second one is asking, has somebody made or persuade you to do that? To the extent that we are able, we're mapping these questions that are already in there for you over to the new 4.35A, because there is an element right now, 4.35, that's for commercial sexual exploitation, and we are doing some mapping for you. RIDE is asking, though, that you actually do ask these questions beginning October 1st to everybody that's in your project beginning on October 1st, 2015. So if they're in transitional housing, you've got to bring them back in and re-ask them these questions, if you can, please. I'm just seeing that the slide heading on this slide is wrong. This is 4.35B, and it's labor exploitation, commercial labor exploitation. And it's the same questions that we're asking about sex, except this time we're asking about work. Were they ever afraid to quit or leave work because of threats of violence to themselves or family or friends, or promised work where payment was different than they expected, or felt forced to work? These are only RIDE questions, so they don't need to be answered by the whole universe of homeless folks in your system. They only need to be asked by the RIDE programs, and RIDE will provide their grantees with more guidance on that, and we'll try to get that to system administrators when they do on how to do that. Okay, there are 2 new elements for SSVF, and again, these are only for SSVF. So 4.44, homeless prevention screening score, and 4.45, BAMC station number are brand new elements. Anybody that's in an SSVF program must have this information entered into their record as of October 1st, 2015. And these answers are answers that the workers would already know. They wouldn't have to be doing a new screening, so they will already know the station number and the screening score. They won't have to bring the client back in to ask the question. They just need to enter the answer into the HMIS system, and this is for SSVF only. So again, these have to be answered for anybody that's in residence on October 1st, 2015 going forward, and they will be part of the SSVF export beginning in November 2015. So your grantees have a month to get it up to date and in there. 4.47 is a T-cell and viral load element. It just is asking for the T-cell count and viral load for all persons that are HIV positive, and these are only for persons that are participating in a HOPWA program. So if the client in emergency shelter indicates they are HIV positive, you do not need to ask them T-cell and viral load. We do not want to know that from other people. It's only the HOPWA clients that would need to know this. And for the most part, the HOPWA provider already knows that if they're connected with Ryan White or are doing some intensive case management with a client. So it's not something in general that they don't know. I'm going to stop and Karen, switch to you.
Okay. Before I get into the next couple of slides that I'm doing on data entry, data sharing, consent, let me just, in case those didn't see the answer to the question, the critical changes, as Michelle said, the vendors have them and are programming them. We have just finished updating the manual and dictionary and to get them 508 compliant so that they can be uploaded to the HUD Exchange. We're working on getting them uploaded today, and I have a listserv message that's being reviewed and hopefully will go out tomorrow at the latest, letting everybody know that the critical changes are now documented in an updated version of the manual and the dictionary. So yes, these will be published, and we hope that you guys will be able to see them in the manual on the HUD Exchange within the next 24 to 48 hours. So just to answer that, I should have said that at the beginning, and I just wasn't thinking. So I'm going to shift gears here a little bit and talk about data entry, data sharing, consent, as the slide says. I think the first thing that I want to say as we start to talk about this very important and very, this is another, we talked about 3.17 causing angst. We know that this causes major, major angst in communities, as it should. We totally understand, and we are working on trying to provide further clarification for folks around client consent and data and just kind of the whole issue surrounding all of that. So the one message I think, or the takeaway that I would like for you guys to come away with after we talk about these slides is, number one, don't panic. We are, kind of taking everybody back to where we were in 2004 to kind of remind everybody what the original 2004 data and technical standards said about client privacy and consent, to share data, things like that. So, this is something that we know that folks will need to work on in their communities. They will need to kind of do a kind of an inward look at how they are structured right now. Folks have seen, you probably saw the listserv message that went out from HUD and the federal partners earlier in the spring, particularly around trying to get the runaway and homeless youth projects into communities' HMISs and some of the difficulties that folks were having if they had implemented a policy that required written consent from a client to enter the data or to collect the data or enter the data into their system. So again, we need to start having this conversation. You will be hearing more from HUD and the federal partners around this entire issue. And as you all probably know and have heard, we will have an updated notice coming out for comment later this year, so it will not be final, but it will be coming out on privacy and security for public comment, so that you all can get an idea of where we're headed, and we can hear back from communities, where they have maybe issues or have some suggestions on how to better provide clarification for folks. So you can go to the first slide, Michelle. So basically, as I just said, we really want to take everybody back. Not that we want to go all the way back to 2004 because we've improved so much over the last 11 years, but just to kind of remind everybody where we started. And again, this is quotes taken directly out of the 2004 notice. This kind of gives the the background for why we even need to collect this information, and all of this still, holds true. And this is all based on not just HUD-specific regulations, but this is really based on Federal Privacy Act and kind of regs and statutes that are larger than HUD, that all federal agencies must kind of abide by. So, we told everyone back in 2004 that anyone, any CHO, what we called them, or covered homeless organization, really can only collect their, personal identifying information when it's appropriate, when it needs to be collected. And, federal funders require folks to report back to us. And we kind of, have the authority to require folks to collect this personal level information to be able to provide an unduplicated count and be able to provide back to us to let us know how many folks you're serving and certain characteristics of who you're serving. The other thing that we said in 2004 was that all contributing homeless organizations must post a privacy notice either at the case manager's desk, the intake station, wherever folks were providing their information, that generally explains the reasons for collecting required HMIS data. And 11 years later, we know that folks have done that, and that, and I think this is where folks have kind of took it to another level. And in addition to that sign, which many kind of coin the phrase, that's inferred consent. You make sure the client sees the sign, they understand they're giving, by kind of the virtue of them reading the sign and then giving you their information, they understand. They understand that you're going to put it into the system. They understand that you need this data to be able to provide them with the best services, all of that. But the next kind of layer to that is you need then to get consent, and you do need written consent to share the data. So let me go to the next slide and just talk about data entry first, and then we'll get into data sharing and some of the federal rules. So you'll see the couple of bullets here. The first, I think, is pretty important. There is no federal requirement to obtain consent to collect data or to enter it into an HMIS. And I have 2 stars here because I want to explain something. While that statement is true, the timing of collecting that consent from a client to share the data is important, and I'll explain that. It's probably confusing right now, but I'll explain that. So again, go back to don't go back to the slide person, but I'm saying go back to the other side where I've already said HUD has never required written consent to collect the data. We know that many communities have implemented this. That's not a HUD requirement. We understand that you have policies in place, and in the case of the youth providers, we actually asked folks to relax that policy. But this is where I think we need communities to start looking at their current policies and seeing if they make sense given the direction that we're moving, or if maybe we need to revisit some things. Again, consent to share data is required. So what I just said about these two little asterisks here that I have on this first bullet has to do with the timing and when data is shared. So while there is no requirement to collect written consent while you're entering somebody's information, so the act of asking the question, the act of actually putting in the HMIS does not require written consent by any federal law or reg or anything. Because consent to share is required, if you are entering that data into a system that upon entering the data into the HMIS, that data is shared, then you need to get that consent to share. And I think that's a gray area that folks then, because the consent to share is happening, or that the obtaining of that consent to share is happening at the time that the data is being collected, folks get it tends to get very tangled up very quickly, and it feels like you're getting consent to collect that data when that's really not the important kind of piece there. You need to make sure that you're getting consent to share the data. So HUD and our federal partners have always had, and we maintain this kind of long-standing policy that you cannot refuse services to clients who aren't able to provide information or who refuse to share it. We know that that happens. But this is not a wholesale pass on data collection. This doesn't mean, you ask the person one time, they say no, and then they're in your shelter for 10 years, or they're in your, not shelter, they're in your, your program for the next year, and you never attempt to collect that information again. As I said earlier, most federally funded projects are statutorily required to collect data on clients served for their reporting purposes. So you have to have a system that's set up to collect the data. You have to ask the questions. We know that clients refuse, maybe right off the bat, they refuse to provide any information. Maybe they refuse to provide certain pieces of information. And we expect that case managers and project staff are trained to work with clients to continue to gather data as the client becomes more comfortable with the program. This is really an iterative process. It's not an ask once and done, and we're going to serve this client anonymously for the rest of their time here. So that's basically what we're asking. And as I said, this is, this gets complex, and there are a lot of what ifs, and oh my God, we're doing this now. Are we out of compliance? The answer is no. I mean, you're not out of compliance with anything yet. We want to work with you all, and you will see a lot more guidance and direction coming out of HUD and our federal partner agencies around these issues. So really, this webinar is really meant to get you thinking, and to you as the lead and the system admin folks, go to your COCs, get your COCs to start thinking, looking at current policy, see the direction that HUD and the federal partners are moving in. Again, it's not meant to make you panic. It's not meant to make you think that you're doing something wrong, or that HUD's going to come monitor you and you're going to be in trouble. That's not at all the case. We'll talk about TA and how to request it at the end of the webinar, but I just wanted to make sure that folks know that this is just, we're starting this conversation. It has to be had, and we're starting to have this conversation with communities, and we want to continue the conversation as we roll out guidance and some training and technical assistance around these things. So the next slide talks about data sharing and the Federal Privacy Act. So this is just a piece pulled straight from the Privacy Act. I won't read it word for word, but it basically talks about the fact that, again, no consent to collect, no written consent to collect the information, but once that information is in your system and it can be shared, this is where you need the client consent. This is the serious point. This is where you would be in violation of federal law if you collect information and the client does not consent that it can be shared either with other programs, within your continuum. So there are 12 law-filled disclosures that are in the Federal Privacy Act. We did not list all 12 here. We will put guidance out, and we can reference the Act. The one that we pulled here and that's on the slide for you all, that we think is important for you all because of the positions that you're in your community as leads and system admin staff, is the first actual on the list of disclosures, and that's that officers and employees of the agency which maintain the record who have a need for the record in the performance of their duties. So basically, we know, and we need communities to understand that, you can't say that an HMIS lead can't see the data. And that is an exception actually covered under the federal law. So again, the key points for folks to understand here are that communities need to make sure that clients understand that where their information is going, they're not denied services if they're not comfortable providing their information, but that it's an iterative process, and that we're continuing to try to get the information from these folks, and that clients do have a choice whether or not their data is shared and who it is shared with. We're really starting to move away from using the terms open and closed systems, because it's been apparent to me for a couple of years now that we've really evolved, and there are very few systems out there, I think, that are really all open or completely closed. And we've really got a hybrid, kind of going on here in many cases, where because of the way we've evolved, and because communities see the benefit in, or even maybe two projects in a closed, quote-unquote closed environment, see the benefit of sharing data between those two projects because they service, similar clients, or they service in clients. So again, we need communities to start to understand, and we need you all as the HMIS lead staff to start to understand that clients need to understand and need to be told that they choose who sees their information and what information they see. So I think the best way to explain this is to just go over a couple of kind of examples or considerations, and that's what you'll see on the next couple of slides. So this next slide, is we kind of coded it by green light, yellow light, red light. So this first is kind of a, I consider it like this is the green light, this is the go, it's pretty broad. This is, you know, a client needs to, again, provide consent, and they can provide like a general consent to share their basic demographic information. I think clients, we know anecdotally, and I believe that this is the case in most places, and most of you all would probably find this in your communities, that clients really appreciate only having to provide their information one time. Information like their name, their date of birth, their gender, kind of their basic demographic information. They know that this helps the case manager determine if they've been somewhere else in the community, if they're already seeing another, somebody else in another program. And so they appreciate not having to provide all of this information every time they sit down with a new person within their continuum. So in this example, you've got general consent, data sharing between projects serving the individual. They're sharing basic client demographics. This is also, as you all know, this is the information that we use. Some of it is the information that we'll use, that you all will use to unduplicate the clients, or that your systems will use to unduplicate and make sure that you're not creating a new record. So as it says here, it's part of the search functionality of the system to support unduplication. So again, this is one kind of general type of consent to share data. It's kind of a general, but general in the sense that it's for general information. And you'll see the different. If we go to the next slide, you'll see kind of the next level up, and this is where we kind of said, proceed with caution and consent. So when we get into project level information that's more than just this basic demographic type information, this same client that has said, okay, yeah, I don't want to give everybody my name every time I go to the soup kitchen, then I come over here to the drop-in center, then I go to the emergency shelter. I'm fine with giving all that information. But they have a right to decide if they want other information shared amongst everybody in the continuum. Things like income, benefits. They may not want this level of detail shared. They may not understand, or they may not think that, well, I go down here for a meal every day. They don't really need to know what my income is. I just want to be able to go in and have lunch, and yeah, I know I have to give my name and talk to the case manager, but they should be able to the client should be able to pick or choose that those pieces of data that they're asked, they're not shared with everybody. So this should be protected slightly more than basic demographic information, and it may be kind of locked down per project. A client just may say, I don't want anybody to see this, but your systems need to start kind of developing the functionality, if they don't already have it, where they can lock down based on the client or based on the data element. So you'll see here on the slide things like this. We're talking about project level data sharing. This is where kind of your coordinated assessment comes into play, electronic referrals, document sharing, that sort of thing. So this is, again, somebody may opt to give kind of general consent for their basic information so they can kind of get into the system, but then this is kind of the next step where they need to understand that while they gave that consent for their basic demographics, they can opt out or can say, I don't want this to be shared. Again, we're asking the questions. We expect them to answer the questions. You have to understand income. You have to understand if somebody's getting certain benefits. We're not saying that, we want, we don't want you to ask these questions. It's just communities need to understand that clients need to be able to determine if and provide their consent, whether this level of information can be shared. So the next kind of highest level, which is kind of the red light, and this is, as you see, our kind of analogy here is, stop. This requires special consent, like the release of information that many of you folks have in place, we know now. These are things like medical conditions, what we call the special needs. So we have data elements that talk about chronic health status, physical disabilities, HIV status, substance abuse, mental health. All of these are very, very, highly protected. They should never be shared without client consent. And, again, the important takeaway here is the client needs to understand that they can opt to not have those specific things shared as well. So overall, we shouldn't be sharing data without client consent. but there are kind of different levels of consent, and I think that's where most folks will probably look within their communities and say, we might need to change things a little bit. We might need to revisit our policy because maybe folks have a more general type consent and have been operating under, well, as long as they say we can share their data, we share everything. And again, you know, don't panic if that's the case. That's fine. That's where you are. But we want folks to start having conversations about, is this really, you know, is this the best service to our client? We need to make sure that, you know, this instance that you're seeing on your screen, like broad general consent doesn't fly for this. We need very specific, can we share, you just shared with me that you have a substance abuse, you know, a substance abuse issue. Do you want that data, you know, that data is going into the system, do you want it to be shared? If they say no, if they don't sign the consent to share it, then it's not shared. So we need you to be able to, we need you to have systems in place that are able to kind of lock down or not share client data by project or by a particular element by a particular client. When I say by project, I know that a lot of folks out there have systems where they can an entire provider that serves only HIV positive clients. That entire provider is completely blind or blocked or whatever they call it, and so you can't see that somebody receives housing there because by virtue of that you would know their HIV status. So we know that that's already happening. We know that a lot of other systems are able to lock down particular pieces of client files, and this is just our way of making folks know this is kind of the direction that we're heading in, and we really need systems to be able to kind of lock down individual elements for specific clients as well. So these were just examples to get you thinking and talking about consent and data sharing in communities. As I said, you know, the privacy and security notice will be out later this year or early next year, but I'm hoping later this year for public comment. We're working with all of our federal partners to develop, to work on these notices, but also to develop guidance kind of for in the meantime, so that you all can continue these conversations and continue to think about this while you're waiting to see the notices and comment on the notices. We're going to have technical assistance providers reach out to communities to check in and offer TA. You can also, communities can request TA around these issues or on anything through the HUD exchange. So I really want to encourage folks to start thinking about this. Again, don't panic. Don't think that, you know, this is a very serious issue, and HUD wants to support you and make sure that you all, you know, are kind of conducting the data collection business in the proper way and are kind of covered on the community end, and make sure that the clients ultimately have the protections that they need as well. And we know that that's really, you know, what we're all in this for, and that's, you know, nobody out there wants to share somebody's data without their permission, you know, in our communities. And so we just want to work together to make sure that you all understand where you should be and what you should start thinking about now, and help you get to where we need to be, you know, in a couple of years once we've got final notices and a final rule. So I know that I think we're a minute or two over the time. I haven't been looking at questions because I've been talking, so I don't know, Michelle or Dan and Joel, if there are any like kind of really big, broad issue questions that you guys want to jump in, and maybe we take just a minute or two, or you guys can just let me know that there's just too many questions and we can just get to them, follow up with people after the webinar.
I think there's a ton of questions here, Karen, on consent and sharing, but for the most part, they seem to understand what you were saying, and the questions are much more technical, like, does it have to be written consent, or is verbal consent okay? How long does a consent form last? Those kind of guidance issues HUD will be helping you with some materials in the future.
Yeah, most definitely. And again, this is really just, you know, this is the first time you all are hearing this. I'm working on a message to get out from, you know, to get out to communities as you know, community-wide or kind of nationwide in the next couple of weeks. So this is not the last time you'll hear about this. We are not just telling you this and then you won't hear anything for 6 months and you'll be kind of left, you know, flying in the wind wondering what to do. We want to work with you all in this. So we'll continue this conversation. And we will get answers to some of these technical questions as we move along, and we'll get guidance out for your communities and for you guys to share with your communities as well. So I want to thank Dan and Joel and Michelle for presenting, and Joel and Dan for kind of manning the scenes. Sorry again for all of the technical issues. We will be better on the next one. If you all have any questions about how to register, for the August or September webinars, I'll go ahead and make sure we send the registration links out again with updated information, updated instructions. We did talk with how we would change the instructions from the first time so that it was clearer to folks, so we hopefully won't have the same issue that we had this time. So we apologize again for all of the technical difficulties. Yes, this webinar will be posted on the HUD Exchange, and the spot, you'll be able to see, hear the recording, and we look forward to talking with you guys, or hosting the next 2 webinars in August and September. So thank you all for participating and bearing with us through the technical difficulties. Have a good day.